Hello friends and welcome to a new sofa session here at SIWI, the World Water Week in Stockholm. We have a live audience here today and we have our online audience following us through social media. We're going to discuss a very interesting topic today, which is the development of impact bonds for urban sanitation in India. So we have with us two professors from CEPT University in India, Professor Meera Mehta and Professor Dinesh Mehta. Welcome to the sofa.
Thank you.
So let's dive into it very quickly. Meera, how would you describe the current situation of sanitation in India and in specific in your state?
Yeah, over last 5 years, India has had a major sanitation revolution, I would say. There has been a emphasis by both political emphasis, so a lot of priority being placed by politicians and starting from the Prime Minister himself, but also backed by budget allocations to the sector, and that has really created a major change in India. And we hope that by October 2nd, 2019, which is the 150th birth centenary of Mahatma Gandhi, that the country will become open defecation free. So that's major sort of outlook that is out there. We work in the state of Maharashtra. Maharashtra is the second most populous state in India. And we work there, we support the government of Maharashtra in these endeavors. Maharashtra has already achieved this landmark of becoming open defecation free. And we now strive to take them to higher levels, achieve the SDG 6.2 of completely safe sanitation.
Wonderful. And in a more local level, what are the everyday challenges that you face?
Yeah, as she said, that we work in the state of Maharashtra, which is one of the most urbanized states in the country, about 400 cities, but only 50 cities have sewerage system. So most cities are dependent on what we would call on-site sanitation, which means toilets are connected to septic tank. Now under the Swachh Bharat mission, every household, at least in the cities, has access to toilet either on their own premise or a public toilet. The key challenge is that these toilets linked to septic tanks are not emptied regularly. Often they are not emptied ever and they are emptied 8 to 10 years later. When that happens, the sludge in the septic tanks or the pits get hardened and then they will need manual labor to go into the pits to empty that. Now in India, this is prohibited by law. Manual scavenging is prohibited. So what we are now attempting to do in Maharashtra, in the cities in Maharashtra, is to introduce what we call a scheduled emptying. That means that every pit or tank will be emptied once in 3 years, and that's the challenge that we are facing. And the two cities where we are working, we have had good experience, good results, and we want to replicate that to all the cities in Maharashtra and then to the country at large.
Wonderful, Dinesh. Thank you. And Meera, you say that, we understand that investments have been mostly limited to toilet construction, right? And not to the entire sanitation chain. So could you tell us more about this?
Yeah, I think Dinesh already hinted at this, that it's not just that you build toilets, but you need to service these toilets in terms of providing a proper emptying service. Very importantly, that whatever sludge and septages are collected, they need to be treated properly, and there are not adequate, or there are actually almost no treatment facilities that exist today. So when we talk of new way of looking at sort of safe sanitation, then you need to have proper emptying service, what Dinesh referred to as scheduled emptying service, because septic tanks need to be emptied regularly every 3 years or 5 years, as well as the treatment of septage must happen. If these things don't happen, they result in environmental problems. Also then when you don't have scheduled service, you have very high emptying fees, and that can actually lead to many households don't empty their toilets because they don't want to pay the high charges, and that can lead to open defecation again. So to ensure sustainability also, these aspects are needed.
I see. I understand you're both professors at the university, but you have worked for the World Bank and the UN. So why this initiative, and why now?
Well, I think it's time to pay back. We are back at the university where we both studied, and so when after working, at least in my case, when I worked in the UN Habitat globally, I found that this is the experience that we need to bring back to the students in India. So that's why we went back to India. Now at our university, we follow the principle of blending theoretical teaching with practical experience, action research. And so this was an opportunity. The Gates Foundation, and very generous funding that was given to us to begin work on water sanitation. So that's how we embarked on this journey 10 years ago.
So let's learn about the initiative. So Meera, what is the Impact Bond Initiative?
Yeah, the Impact Bond essentially is trying to bring the impact investment to sanitation sector. Very simply put, because currently sanitation sector is being looked at as that it will be funded through public resources only. And we feel that if you bring in additional investment, it will leverage additional resources, but also that this kind of investment will bring in the rigor and monitoring which are essential in the sector, so that the infrastructure that is built, the services that are provided are good, are sustainable, cater to the poorest also along with everybody else, and remain sustainable over time. So that is the reason for bringing an impact investment in the sector.
I see. And Dinesh, what problems would this solve?
A range of problems. I think, as we are saying, one is that the impact bond will bring in this water week, we keep hearing, whenever we talk about financing, we keep hearing the phrase repayable capital, outcome-based funding. Now, impact investment is precisely that. It's a repayable capital. It is something that where money is returned back only on certain outcome. So what we want to demonstrate, that sanitation is a proposition for investors to come on board. There has not been any impact bond for sanitation as yet. We want to demonstrate through some pilot projects in India that this is a possibility, that it is a sector where returns are possible to the investor, and we have programs ready for investors to come on board.
Wonderful.
Also, and just to add that we actually have models in Maharashtra working with 2 cities that Dinesh earlier referred to, that actually this is really possible on the ground. So it's not that we are talking of ideas that are not really doable on the ground.
I see. So going back to the initiative then, Meera, how would it work? Which stakeholders would be involved and which would be their roles?
Yeah, mainly to start with, it's at the local level, so local government and the private provider will be the key players at the local level. The second major player will be the impact investor. So we need to formulate the idea that we have in terms of this project where we combine schedule emptying and treatment into a single project structure. The impact investors need to be attracted to this. But in a development impact bond structure, we will also need outcome payers, which will be foundations or development agencies, bilateral agencies, who will actually say that yes, if outcomes are achieved, we will repay the impact investor. So that is a simple model that we have for a DIB.
Okay, wonderful. And Meera, also, in which way is this initiative different from the rest of initiatives?
As we said, to some extent, that I think this initiative would be different in a sense that it's not limited to looking at only public investment coming in the sector. Although it is true that given the public benefits of sanitation, public investment is necessary. But if you leverage other resources, as I said earlier, it would also help to bring rigor in the sector. It will help to bring monitoring in the sector, which otherwise is not there. It will help to demonstrate that results-based funding mechanism are possible in sanitation sector. We've actually, in the 2 cities where we work, we've introduced rigorous monitoring systems. For schedule emptying, we have an IT-based system. It's almost like your Amazon app, where people who receive the service will be signing off. And that's a mechanism that will be used to monitor the entire service. Similarly, online monitoring system for the treatment facilities, so that you actually know whether the treatment is proper or not, whether the quality results that are expected are being delivered or not. So we have these models already going on, but to make them happen on a large scale, it is measures like this that will be needed and hopefully essential.
Yes, hopefully you'll get the message through, and you will get what you're seeking now. So, Dinesh, what are the next steps now for you?
Well, the next step is we are looking for investors into our project. As Meera is saying, that impact investing bond will have the investors, then the impact bond manager. We could play that role, or we can get to some of the more professional companies. And then you need the outcome payers, who we hope that in the beginning, in the first stage, there'll be foundations, philanthropic organizations, or others who will come on board. Once this happens, and our pilot project, we are only looking at a funding of about $1 million, which will service a city for 5 years, 100,000 population, and that's replicative of a large number of cities in India and the rest of the developing countries. So once this model works, I think we have enormous scope to replicate it in India and elsewhere. And as a first step, we would like to replicate that in the state in which we work, with 300 cities, but then take it on to others. So but the first step is to look for those investors, who get them on board, convince them that this is possible, their capital will be returned, and we probably will give them more than what the American bank or Japanese bank give them as return. So I think that's possible.
Okay, that's a wonderful message. Thank you, Dinesh. Meera, would you like to add something to that?
Go ahead.
I think the idea of scale, idea of public, how do you leverage public financing to bring in this is very important. Although we are talking of foundations to bring in sort of capital to pay off the investors, in the long term it's really so from development impact bond we would actually move to a social impact bond structure. The kind of models that have been developed, the first one that was done in UK, but this would help to bring in government funding into the sector to pay off the investors. So it's really linking public finance and private investment, the finance together in a more effective manner that will be possible. But this is important because currently we feel that the regular investors may not have faith in local governments, may not in India, but they may not have faith that local governments will repay this. So first a few structures are necessary where we use this kind of foundation or philanthropic money to pay back the investors. But we are very confident that over time, if we have 2 models or 3 models of this successfully implemented, it can be scaled up effectively with using public resources also.
Wonderful.
That's our dream, so to say.
Okay, thank you. Thank you very much for sharing all this information. Thank you, Dinesh. Thank you, Meera. They're both professors at CEPT University in India, and they shared with us this initiative, which is Impact Bonds for Urban Sanitation in India. I guess I'll see you around.
Thank you also for giving us this opportunity.
You're welcome. And thank you, live audience here. And I will see you at our next SOFA session at the World Water Week organized by SIWI. Have a good day.